So for our last but not least Pechakucha, I'd like to invite Seema Marwaha to come up and share with you the work that she has been doing.
Hey everybody, so I just want to disclose I am 8 days away from my due date. So let's hope the stress of this presentation doesn't stimulate anything. I also want to thank AMS for funding what has been 2 incredible years of research into patient and family stories. My whole research team who made research possible is sitting at these tables over here, so I just wanted to acknowledge them, Andreas Lopakis and Trillium Health Partners. I was able to do 3 sort of mini projects in my 2 fellowships, and for this Pechakucha, I focused on the 3rd one. So how do you best understand the depth and breadth of a complex issue? Ontario's opiate use is as complex a health issue as you can get. I want to introduce you to the Opioid Chapters, a photojournalism project that attempts to help us better understand opiate use in Ontario. Opiates get a lot of media coverage. The headlines often crisis report, focusing on deaths and abuse. This can be fear-inducing for the public. The idea is to mobilize people into action. These headlines drive policy, but do they tell the whole story? Research is also really important in helping us understand the opiate crisis. 1 in 7 Ontarians receive an opiate prescription each year, and this is about 10 million scripts. There are 3 opiate-related deaths in Ontario every day, and these numbers and the research that contributes to them help drive policy change. But do they tell the whole story? I'm here to convince you that when it comes to opiates, patient stories matter. We need more than data and headlines to understand the complexity, and we have to acknowledge and understand an entire spectrum of human experience. This is a human crisis, human experiences, and there's a human toll. The Opiate Chapters is a photojournalism project intersecting with research. Healthy Debate and ODPRN, which is a research group, collaborated to fill our gaps in understanding this crisis. We interviewed, photographed, and documented 11 people with experiences with opiates, good and bad. They told us their stories in their own words, and we just listened. Now I want you to meet Jackie. She's a wife and a mother from a small town. 10 years ago, a friend crushed up a few Percocet pills and offered them to her. For the next 8 years, she would use other people's prescription Percocets on a daily basis, leading to conflict and a significant amount of financial debt. But today she's in recovery. In her own words, quote, "There should be a more watchful eye on people who are on lots of narcotics. If you're getting 120 pills a month, then maybe you should have drug tests to see whether you are taking them," end quote. In Jackie's small town, it was incredibly easy for her to find people to buy unused pills from, with very few resources for her to get help. She admits that she likely had untreated depression, relationship issues, and a deep-seated feeling that she ultimately doesn't deserve love. The opiates help numb these feelings. Lack of access to mental health resources drive many, like Jackie, to self-medicate with opiates. And for 10% of people, prescribed opiates lead to dependency. But not all long-term prescription opiate use is abuse. This is Michael. 15 years ago, he suffered a back injury. He could hardly walk, and it has never completely resolved. He has tried everything under the sun to help his pain, from acupuncture to marijuana, and opiates are the only treatment that gives him some relief. He's been on a stable dose for 15 years and now has gone back to work. He says, "I understand the need to protect people, but what we don't hear about are people like me who require opiates to function. Without them, I'm not going to be a functioning member of society anymore." Michael is a chronic pain patient who needs opiates to live. He lives with the fear that his supply will one day be cut off. In Ontario, new prescribing guidelines recommend much lower opiate doses and changes to funding. Michael represents a whole subset of chronic opiate users who require small daily doses. He is alienated by the current media coverage of the opiate crisis and often is treated like an addict, even though he never abused them. Illicit opiate use is also part of the spectrum of use. Henry became a user at a young age. When he was a child, his mother was a sex worker, his father died in jail. As a baby, when he would cry, his parents would give him drugs and alcohol to keep him quiet, and this eventually led to prostitution and incarceration. He says, quote, "People on opioids come from different ranges of life, but we all have one thing in common. We all had a crisis that got us there, so never mind the opioids." For Henry, focusing on opiate addiction was too little too late. He says going to jail, where he forced himself to get clean, is actually what saved his life. Henry has since graduated from college and works as a community services worker. He's married and he's happy. He's a strong advocate for giving drug users the tools they need to start their lives over. He wants policymakers and doctors to realize the vicious cycle. Focusing on addiction and crime, and not the trauma that got them there, fuels the abuse. Now, I also want to acknowledge that there are many people we couldn't interview because they're already dead. This is Greg. One morning, he came down from his bedroom to find his wife slouched over on a chair. Sometimes she fell asleep there. But Greg realized her body was cold. He tried checking her heartbeat and called 911 immediately and realized she was dead. She used opiates for chronic neuropathic pain. He says, and I quote, "When she wasn't breathing, I called 911 right away. I was just hoping I was doing something wrong or that I was missing something." Greg didn't know what caused his wife to die. Days before Christmas, he was called into the police interrogation room of his town, informed he could have a lawyer present, and told that she died of a fentanyl overdose. 80% of all opioid-related deaths are accidental like this one. We also interviewed providers, some of whom dedicate themselves in resource-poor environments to helping people in need. According to them, large societal issues feed the crisis, things like housing, access, social services, and remuneration for services. Quote, "Sometimes you have to listen to patients and not just reach for a prescription pad," end quote. In all, we interviewed 11 people. 11 is not enough to tell the quote-unquote whole story, it just scratches the surface. But what it did do is we started to see ourselves in each and every one of the people that we interviewed. They could have been our mother, our sister, or our child. A favorite quote of mine from a patient interview, quote, "The health system makes me feel like Alice at the Mad Hatter's Tea Party. I had woken up in a world that seemed utterly logical to its inhabitants, but quite mad to me," end quote. Just because we work in healthcare doesn't mean we understand what patients go through. We just don't know. And this is why understanding individual experiences of using the system can do so much. So in conclusion, stories matter. Even if we're not sure how they fit or how they should be used, we need to seek out the experiences of patients and families. Experiences and stories spark a conversation about the risks and benefits of opioids. Experiences are complex, and they help us realize that there's never a simple solution. Thank you.